Hello, thank you, Steve. Our purpose here today is to discuss how climate change impacts health, both at the individual and community level. We're going to talk about how policies that we develop can mitigate and reduce the impact of those health outcomes, and what we can do to make sure that our mitigation efforts and our plans are equitable between all members of society, whether they are socioeconomic status, ethnicity, geography, and education level and language. Okay, I am the chair of the Bluegrass Group in Kentucky. In addition to being a member of the Climate Adaptation and Resilience Green Grassroots Network, in my professional life, I am an environmental epidemiologist, which is basically a person who works with data on health and health-related issues. And I specialized in environmental health, especially the impacts of climate on health. And I worked with the Environmental Public Health Tracking Network, which you are going to hear about through this day. So let's start off with talking about exactly how climate impacts health and why. So, okay, I'm going to try and share my screen real quick, but first I have to get out the thing I want to share. Okay, now, let's try that again. Let's see. There. Okay. This graphic is developed by the Centers of Disease Control to describe the link between climate drivers, resulting weather climate outcomes, and the resulting health impacts. Here in the center of the circle, you see the primary climate drivers. In this little corner here, even though it's at an awkward angle, you have increasing CO2 levels, which have been documented. Although we can debate the cause of the rising CO2 levels, we cannot debate that there's more CO2 out there in our atmosphere. The results of the CO2 levels, are increased temperatures, which lead to more frequent and more severe weather outcomes, such as storms, also rising sea levels. And on the second circle here, you see what happens to the environment as a result of these climate drivers. Air pollution, extreme heat, these are like the direct impacts, and then you have the indirect impacts. So in this external square out here is what you see are the health outcomes: respiratory and cardiovascular health, mental health, heat-related illness, and direct injuries from storms and floods. You also have impacts on infectious disease outbreaks, because you have disease vectors like mosquitoes and ticks that are getting into a wider area, getting into areas where they weren't before. You also have impacts on infectious diseases affecting and pathogens into the drinking water. Also impacts food security, access to healthy and adequate food supply. So, okay, I'm going to stop sharing, and then I'm going to talk about the three speakers we have today. And I apologize in advance if I say anything incorrect. First speaker we have is Natasha Desjarnette. She is a professor at the University of Louisville School of Medicine. And she has also been an associate director of the National Environmental Health Association. Secondly, we have Adele Houghton. Adele Houghton is a public health doctoral student at Harvard University. And she has also worked on several projects here in Kentucky. Last but not least, we have Gradia Huerta Montanez, who is in Puerto Rico. She is a physician and was instrumental in making a physicians association that deals with environmental health issues with children. And I'm sorry, I forget the name of the organization, but if Gradia could tell us, Dr. Montana, could tell us.
Clinicians for Climate Action.
Thank you. Thank you. And I apologize for that brain blip. Okay. Okay. So with that introduction, I will turn it over to our first speaker, Natasha Desjardins. Thank you.
Thank you so much for having me. I'm looking forward to our dialogue today and certainly to hearing from the other speakers as well as our Q&A that is to come. So bear with me just a moment as I share slides. Does everyone see a presentation? And you just see slides, not notes, correct?
Looks good.
Perfect, thank you. All right, so I am honored to be here. Thank you, Colleen, for the kind invitation. I work at the Christina Lee Brown Environment Institute, and at the Environment Institute, we look at all the environmental factors, be those natural environments, social environment, or personal environments, and how they relate to health. Particularly, we look a lot in terms of cardiovascular health. You can see here our paper that really was released at the establishment of the Environment Institute. I'll share that paper through the chat in case anyone is interested in understanding more about the omics approach to environmental medicine. Also, the Environment Institute is complete with 7 collaborative research centers. So we partner among and across disciplines to understand environmental burdens of disease and to identify interventions to help improve health and quality of life. So the National Environmental Health Association's Executive Director, Dr. David Dijak, frequently describes environmental health as being inherently local. The same can absolutely be said of climate change, as evidenced here by Dr. Jonathan Petz and Dr. Madeline Thompson. Importantly, I want you to consider that these differences that we can experience can be felt in different population segments, in different geographic locations, and even in the same neighborhood. And we'll touch on that as we go through this discussion today. Examining the justice aspects of climate change means that we can't only look at climate in its own bubble. Therefore, I want to point out to you that while we face climate change, we're faced with multiple health emergencies, and some are exacerbated by climate change or confound our response to climate threats. Consider 3 health emergencies. Climate change, the topic of our discussion today. 2020 was tied with 2016 for being the hottest year on record. Also, this completed the hottest decade that we've ever experienced. Also consider that 2020 had a record-breaking number of 30 storms to make landfall on the US. We even went into the Greek alphabet to name these storms. And we also had an unprecedented wildfire season. And we're still learning about the dangers of this wildfire season. We have just seen recent publications that the particulate matter in wildfires is more toxic than what we've been exposed to in industrial and automobile emissions. That's one health emergency, climate change. Also consider COVID-19, certainly top of all of our minds as we speak, why we're having this conversation virtually. So COVID-19 certainly a health emergency that we've been facing. And then we have our racial reckoning that in the face of police brutality events that took place last year, the response has been a racial reckoning. And many health department states have now declared that racism is a threat to public health. So at the intersection of these compounding emergencies, I wanted to share with you this quote from Dr. Jalon White Newsom. She is an environmental justice leader and formerly with the Kresge Foundation. And in a post about this time last year, she shared that across the US, climate change and COVID-19 are playing out in tandem. The warming planet drives increasingly extreme weather, compounding the pandemic's impacts and complicating disaster response. At the same time, these dual threats have exposed the profound inequities that divide and weaken us. And that continues to reign true today. So, about this time last year, we were uncovering some of the COVID-19 disparities. We found that there were certain ethnicities that appeared to be more heavily burdened with COVID-19, that older adults were more susceptible, that populations that lived in low income communities or were low income themselves were also more susceptible. And then, certainly for health status, there were certain health factors that may complicate the burden of this disease: heart disease, diabetes, and other chronic illnesses. And by November, and this data comes from CDC, and by November of last year, we found that the burden of this disease across different ethnicities is quite different. So each of these factors for cases, we found that American Indians, Alaska Natives were nearly 2 times more likely compared to Caucasians of developing COVID-19, 4 times more likely to be hospitalized. For Asian and non-Hispanic persons, 1.2 times more likely to be hospitalized. For Black and African Americans, nearly 4 times more likely to be hospitalized, nearly 3 times more likely to die, and very similar stats for Hispanic and Latino populations. I shared that with you. Did the slide change? Pause. Waiting on the slide to change. I'm trying to be patient. It's a very large PowerPoint, so I'm going to try one more time. Okay, here we go. I share that with you because what I find very interesting about the populations that are at greater risk of COVID, they also bear a heavier burden of the health threats of climate change. And as you've seen from what Colleen shared, the health threats of climate change are vast. But one thing I want to make sure is perfectly clear today that I don't clearly state in the remainder of my slides, but I do not want it to be left unsaid, is that we're all at risk to the health threats of climate change, but there are some populations that bear a heavier burden, and climate change actually can be a threat multiplier for these populations. These groups may already be experiencing inequities, and climate change adds another layer of burden on top of that. So I'll quickly give a preview. We'll talk about some of these more as I go through the different climate impacts, but children are quite susceptible. Children, they still have developing organ systems, and so exposure to toxins during certain stages of development can lead to short and long-term consequences of those exposures. Older adults are more likely to be socially isolated. They're also more likely to have other chronic diseases that can make climate change more of a threat for them. We have impoverished communities and communities of color. They bear a heavier burden. They are more likely to live on the fence lines of industrial polluters, leaving them more exposed. We also have indigenous communities who have really close ties with the land. And so climate change can be an especially unique burden where they have close cultural, religious, and social ties to the land, and drought and sea level rise is complicating that. We also have people with a disability may not be as easily able to relocate in times of a severe weather event or any other natural disaster need to evacuate. Undocumented residents may feel less comfortable going to storm shelters for fear of deportation or otherwise. And it's really important that people do evacuate to safety when we're able to. And then LGBTQ people may also not be as comfortable going to storm shelters for fear of discrimination or worse. So we can't truly address climate change if our most vulnerable do not benefit from climate action. Therefore, we can't meaningfully address climate change without addressing justice. Even the most well-intentioned efforts to address climate change will be undermined if justice isn't at the center of action. So I'm going to briefly step through these different climate impacts and how they relate to health and highlight some of the justice aspects. So we all deserve clean air to breathe. I believe we're all here talking now because we believe that we all deserve clean air to breathe. But as Colleen shared, climate change is decreasing the quality of that air. We have increased carbon dioxide levels in the atmosphere, trapping heat and pollutants below, much like a blanket traps heat. So air pollution decreases our air quality. This extra trapped heat also decreases our air quality. Climate change promotes drought conditions, which can create environments that are conducive to wildfires, and the smoke from those wildfires also decrease our air quality. And then we have a longer, hotter, warm season, and thereby a longer and more intense pollen season. So we have more allergens that we're exposed to. We also have more flooding. So we also are exposed to it can increase our exposure to mold, another potential allergen. So bringing these together, climate change increases our risk of asthma, heart disease, and allergies. And these aren't just a nuisance. These actually contribute to absences from school, absences or decreased productivity in our workplaces. And we certainly need our children in schools when it's safe, because their presence in school, it definitely correlates with health outcomes long term. But as I said, we can't think of climate just in a bubble. We must examine air pollution's risk for chronic disease as well as infectious disease. So looking at COVID-19, earlier in 2020, Dr. Francesca Dominici of Harvard University and others demonstrated that cities with higher pollution have higher COVID mortality. In addition, their research suggested that even a 1 unit increase of PM 2.5 was associated with an 8% increase in the COVID-19 death rate, meaning that more polluted cities may have more COVID mortality. This additional set of figures, you'll see that Brandt and others lay out a case for further investigation of the relationship between air pollution, COVID-19, and those COVID-19 mortality disparities by race. I want to take you on a deeper study to further provide insight on the potential link between COVID-19 mortality and air pollution. So let's take some time and explore the regulatory pause on environmental regulations that occurred in 2020 due to the pandemic. Now, my set of disclaimers. I am not here to point fingers at any government agency, but the regulatory pause that occurred in 2020 gives an opportunity to better understand the relationship between COVID and air pollution exposures. And then I'll also say in this disclaimer that much of the public health workforce was called from their regular public health duties into COVID action. I was at the National Environmental Health Association this time last year, and we issued a survey out to the environmental health workforce. And we discovered that by about this time last year, at least half of the environmental health workforce was called into COVID response action. So there also may not have been enough experts to participate in these regulatory activities for the need to address the pandemic. Those are my disclaimers, but let's explore further the relationship between COVID mortality and air pollution through this regulatory pause. I'm going to be sharing results from you that Claudia Prosecco and her team at American University shared during an American Lung Association webinar last July. They found that during the regulatory pause, there were higher levels of PM 2.5 and ozone being emitted. They also found higher COVID cases and deaths during this time. Furthermore, they found disparities that this relationship between air pollution and COVID was worse in counties that had a higher percentage of African Americans. And so this drives a hypothesis that counties with higher toxic air releases may have higher COVID rates. So here's some of the data that they shared during that webinar. They looked at the toxic release inventory, which is provided by the EPA, and found that communities with more toxic release inventory sites had larger increases in pollution during the regulatory pause. They also found that counties that had more toxic release inventory sites had more COVID-19 deaths during the regulatory pause. So increased pollution and increased COVID-19 deaths during during that time. Their data suggests, therefore, a positive association with the number of toxic release sites and COVID deaths. So as the number of these polluting sites increases, the amount of COVID deaths was also increasing, suggesting that higher pollution is linked with higher COVID mortality. So I've taken you to the dark place. I don't want to leave you in the dark place. So I'll tell you about these different ways that climate impacts health, but I'll also share with you some of the work that's being done to adapt to the current climate that we're facing. So at the University of Louisville, our Envirome Institute has partnered with the National Institute of Environmental Health Sciences and the Nature Conservancy to launch the Green Heart Project. So in this project, we are planting trees for healthier air. We're looking at heart disease risk and air pollution levels, and then planting trees, and then looking at heart disease risk and air pollution levels after planting of these trees. It's a very exciting study. We are to the phase that we'll be planting trees this summer, but this is one way that communities across the US are adapting to the poor air quality and heat impacts. Other things that take place in the workforce include testing air quality, disseminating air alerts, and enforcing air quality regulations, as we just had a deep dive on the importance of that. Transitioning into extreme heat. Heat is a top cause of natural weather-related death in the US, and climate change is increasing the frequency and intensity of these heat waves. We have increased risk of heat-related illness, heat exhaustion, and heat stroke. Heat stroke can be deadly if not treated quickly. Extreme heat also increases or complicates heart disease risk, respiratory diseases, particularly children can be quite susceptible. There are multiple populations that are uniquely burdened by extreme heat. I've touched on some of those, including older adults that have more chronic disease, more socially isolated, may not realize that there's an extreme heat alert. Children, they may spend more time outdoors, so they may be more likely to be exposed to extreme heat. They don't really have the capacity to know when they've overdone it, when they need to come inside and cool off, when they need to have some cool water to cool off. So they can be quite susceptible when it comes to extreme heat. And then there's urban heat islands. So we have communities in the US that are asphalt laden, and this attracts heat in these communities. Urban heat islands can be as much as 20 degrees hotter than their counterparts at night. In addition, we also have to consider that where people live is not necessarily a choice. There's historic redlining that has impacted where people live. Knowing that this happened doesn't necessarily mean that people are able to pack up and leave or want to, because they have social ties to these communities. These communities tend to be more polluted. And recent study published in 2020 from Hoffman and others, I believe it's at University of Virginia, they found that redline communities have higher temperatures, have higher heat events. And then very recent, well, actually, I'll come back to more that we've learned about redline communities. But I want to highlight for you another population, a couple populations that are uniquely burdened by heat. This is data from CDC's Morbidity and Mortality Weekly Report from last summer. And they report that whites or Caucasians have the highest deaths related to extreme heat. If you look at by number, the number of deaths, but if you look by the rate is much higher for American Indians. So I wanted to highlight a population that's uniquely susceptible to extreme heat. And then I want to give you one more population. Shown here in the second figure from the American Journal of Public Health in 2018, They examined heat-related mortality differences between US citizens and non-US citizens. And they found that among heat-related deaths in the US, 4% were among US citizens, while 96% were among non-US citizens. You may not have realized this is actually a bar graph here because of how stark that difference is. This is the 96, the non-US citizens. This is the 4%, the US citizens that die from heat-related mortality. They also found that a majority of these deaths take place in Arizona, California, and Texas, giving us insight on some key populations that are uniquely burdened by heat-related illness. But what's happening to address heat-related illness? Very similar to what I shared with you before, vegetation, increasing vegetation, planting trees, that helps communities. It not only can purify the air, but it provides shade. Changing the way we build our buildings, the direction our buildings face, and changing what our buildings are built with, not having roofs that attract the sunlight, but having roofs that reflect the sunlight. Also, in addition, we educate the community of what to do in an extreme heat event. We also ensure that alerts are disseminated and that alerts are disseminated far and wide, thinking creatively of how to get these alerts out. For example, my grandmother of 96 years may not receive a text message telling her that there's an extreme heat alert. So making sure that we can reach uniquely burdened populations that might not be reached by common means. And then also access to cooling centers is crucial in communities that may not have easy access to air conditioning for a number of reasons, ensuring that cooling centers are available and that they can be utilized. Also important in terms of adapting to extreme heat. As Colleen shared, we have increased carbon dioxide in the atmosphere, increasing the surface water temps and making the frequency and intensity of extreme weather events both more frequent and more extreme. 2017 was a record-breaking year for hurricanes in the US prior to 2020, with Hurricanes Harvey, Irma, and Maria all making landfall in the US within a very narrow window of time. These photos here are from Hurricane Harvey, and I wanted to highlight to you some of Hurricane Harvey's youngest victims. And this shows the inherent vulnerability of children in extreme weather events. They're completely dependent on adults to make decisions for their well-being and their well-safety. And we can see the vulnerability of children captured here in these images. Let's do a deeper dive on Hurricane Harvey and the widespread impacts of it. Injustice with exposure to these storms can lie in the recovery and the response efforts. So resource-rich communities can return to normal quickly. Meanwhile, communities of color, impoverished communities in Houston, we're still working to rebuild a year after Hurricane Harvey. And we've heard the same of Hurricane Katrina, a very, a very unfortunate example of inequities in hurricane and disaster response. But because the communities of color and the low income communities in Houston were more likely to live near industry, this became really problematic when industry was flooded and those toxic waters contaminated these communities. But looking at Hurricane Harvey as a whole, there were over 30,000 people that were evacuated. Displacement definitely affects our health and certainly our mental wellness and well-being. There were at least 63 deaths that took place in Hurricane Harvey. There was a loss of access to services that was brought about by damage to infrastructure. And so we also have to think that when there are these storms, this disrupts our access to needed medical service at times where we need them the most. And then there was water contamination, as I pointed out. So there were increased reports of gastrointestinal illness and skin rash that occurred during Hurricane Harvey. So what is the workforce doing to address extreme weather? So ensuring strong evacuation plans, especially in areas that are flood zones, And having these plans, but also ensuring that people are able to access safe evacuations, quite important. Disseminating alerts in advance and making sure that these are received widespread, and ensuring access to evacuation, that there aren't barriers where in Hurricane Katrina, we, hear reports where a lot of people say, I needed to work, I needed to be available for work. So ensuring that people can have access and have the means to access, and that transportation is provided to be able to do so. That said, I know your mind is probably thinking like mine. The pandemic certainly compounds our ability to carry out these types of extreme weather adaptation, and that's certainly something to be considered. Speeding right along, extreme precipitation increases our health threats in a number of ways. I've touched on flooding, the risk of water contamination and community destruction, but drought. We're uniquely burdened by drought in quite a few ways. Certainly, it affects our agricultural communities adversely by potentially decreasing crop yield. This can contribute to malnutrition. And we've also touched on wildfires, how drought creates conditions that are conducive to wildfires, and the smoke increases our risk of asthma and heart disease, in addition to immediate threats. But here are a few additional populations and additional content around populations that are uniquely burdened specifically by drought. Impoverished communities can experience food and water insecurity due to drought. Agricultural workers have close ties to the land, and these are close economic ties to the land. And the impacts of that can certainly impact mental health when there's that economic threat. And there's a study from the mid 1980s on farmers in the Midwest where there was a significant drought, and the suicide rate among farmers rose significantly during that time. So these are very close ties to the land, but very close economic, and has grave impacts on our mental health. Rural communities, they may be more reliant on private drinking water systems or well water, which can be susceptible in drought. Tribal communities, as we've touched on before, close ties to the land. And as COVID-19 exposed for many, to many of us that may not have been aware, that there are tribal communities in the US that do lack running water. Drought further burdens these communities. People with chronic illness like kidney disease, diabetes, hypertension can be impacted by drought, and certainly race and ethnicities. People of racial and ethnic minority can experience heightened economic threat when it comes to drought as well. So I'm getting close to wrapping up. I can feel myself depressing the audience, but as I said, I don't want to leave you in this dark place. There is much that's taking place globally to address the threats of extreme precipitation, and that includes educating farmers on climate smart practices. So we're seeing this happen globally, including activities like crop diversification, soil and water conservation. This has great impacts on household diet diversity, as well as gender differences can even be impacted here. Other things that are taking place in the environmental health workforce include assessing soil and water quality so that advisories can be issued when there is a breach to soil and water quality. So lastly, in terms of the health impacts, that climate imposes on us, vector-borne disease. Climate change increases the amount and geographic distribution of disease-carrying mosquitoes and ticks. And my example is Lyme disease. And not too long ago, I would share about Lyme disease, and I would say that in Maine, maybe 15 or so years ago, Maine was reporting 6 or so cases of Lyme disease. 2 summers ago, Maine was reporting 1,500 cases of Lyme disease by midsummer. So ticks in particular are able to grow and thrive in places that were once uninhabitable for them. And the same can be said of the vectors that carry West Nile virus and Zika virus. You can see how the spread of Zika virus, West Nile virus has changed across the US. between 2010 and 2013. A One Health approach is useful to addressing vector-borne disease. One Health is a collaborative effort of multiple disciplines working nationally, locally, globally to attain optimal health for people, animals, and our environment, which is why this type of solution lends itself to vector-borne disease. Also, we educate communities, but we also educate physicians to know to expect to see more cases of Lyme disease, to educate their patients on using insect repellents or encouraging people to wear long sleeve, lightweight clothing to protect themselves. Biggest role of the environmental health workforce is vector, the second biggest role of the environmental health workforce is vector control, second to food safety. But ensuring that we use integrated pest management solutions, so not just spraying and treating and eradicating, but also eradicating through understanding the habitats of vectors and addressing that, like standing water, for example. Encouraging communities to be on the lookout for standing water and addressing that in their areas. So I want to make sure that it's not lost, that it's not just physical health that is threatened by climate events. Our mental health is also at risk. Exposure to extreme weather and floods can increase risk of stress, anxiety, post-traumatic stress disorder, and depression. Nearly half of Hurricane Katrina survivors developed a mood or anxiety disorder. 1 in 6 of Hurricane Katrina survivors developed PTSD. Extreme heat or extreme weather can increase risk of depression, violence, suicide, and suicidal ideation. Also, extreme heat can even render inactive some psychotropic medications. Lastly, extreme heat can cause conflict, especially internationally between countries where people need to seek refuge from these unnatural conditions. So with that, I thank you for your time. I welcome questions during the question and answer portion, and I very much look forward to hearing from the other presenters. Thank you so much.
Thank you so much. I'm really excited to be in this group, and it's always fun to co-present with Natasha, and she did such a great job of laying the foundation of what the health effects of climate change are, how humans are experiencing them, and how we are experiencing them differently in different locations and among different populations. What I'd like to share with you all today is the report from a project that I worked on with a local health department in Kentucky a few years ago that looked at specifically how can you take the information that Natasha shared with us and then apply it at the local level, and what does that mean, and how could you what would be the impact of taking a global phenomenon and understanding how it affects your specific situation and your community. And I'm specifically going to be talking about a rural population in part because it's something that hasn't been researched very much. And so first I'd like to just kind of start out with giving you an idea of how this project came about. It was a really great example of a local health department taking advantage of 2 national programs and then combining them into a single project that was helpful both to them and their planning process and their ability to plan for how to help their community. And it also was helpful for the state health department and hopefully to the residents of the community and the state. So basically what happened was the Green River District in Western Kentucky has started developing community health assessments, which is a way for the health department to get an understanding of the needs of the community. What are the health challenges within the communities that they serve, and what are the attributes that they have that are positive force, so that they can map out that landscape. And in this case, you can see they were using a tool called MAP, and then use that to develop a plan that would help them prioritize their services as a health department. At the same time, the State Department of Health, which is where Colleen worked, as it happens, was working with the CDC, the Centers for Disease Control in Atlanta, on a project that the CDC started about 10 years ago or 15 years ago, maybe now, to identify environmental health hazards and exposures and health outcomes, and try and find a way to map them and provide information that's systematic, standardized across the country, so that both public health researchers, but also local health departments and the general public would have an understanding of how that geographic difference that Natasha was talking about kind of maps out across the country. And so they had these grant programs for specific states, and Kentucky received one of those grants to create a specific portal of environmental health data and health outcome data specific to Kentucky. And part of the work, the way that they used that money was to allocate mini grants to local health departments, so that the local health department could decide, you know, these are some issues that we've really been wanting to understand better and measure, but we haven't had the funding or the capacity to do that. And so they took these mini grants and used them as sort of pilot projects to help feed into the portal at the state level, but also help the work on the ground. And so where I came in was I was a consultant, and I work with environmental public health indicators and climate change and health. And so I was brought in to sort of bring these two pieces together to help identify indicators that would be useful to the 7-county region in Western Kentucky to use in their community health assessment, and then also feedback into this state portal. So I just want to give you a quick kind of overview of the Green River District. You can see where it is in in green on the left-hand side of the state. It is a 7-county district, and you can see, if you look at this graph, the dotted line shows the average percentage of people living in Kentucky that live in a rural area, and the red line shows the average percentage of people in the US who live in a rural area. And you can see that 5 of the 7 counties are way above even Kentucky in terms of the percentage of population that lives in a rural area. And even the last 2 were pretty high above the US percentage. So this is a very rural area. And the reason why this is important is because the majority of the grants and funding around research that's been done on climate change in the United States has been focused in urban areas. So Natasha was sharing information that comes both from the US and internationally, and international research has looked a little bit more at rural communities, but there was identified in the 3rd National Climate Assessment a gap in research on, you know, is it really possible to translate what we're learning about the health effects of climate change in urban areas to rural areas? Or are there things that are unique about rural areas that we need to be paying attention to so that we can develop our infrastructure in terms of climate response and preparation and mitigation and adaptation to those populations? And so that was a gap that we felt was something that we'd like to help to fill in. And just like Natasha was saying, the way that we approached the project was to think about climate change as a force amplifier. So it amplifies vulnerability. In any given location in the United States, you have a kind of a baseline of levels of vulnerability to extreme weather events, to vector-borne disease, to air pollution, just like Natasha was saying. Climate change increases exposures to hazards that have a historical presence there. Like, I live in Houston, I lived through Hurricane Harvey, I've lived through many hurricanes. And it is true that, you know, when I look at the scientific record and the projections about how hurricanes are, you know, holding more precipitation in them and moving slower across the land, we saw that in Hurricane Harvey. And then, just like Natasha was saying, the other thing that climate change does is it introduces new hazards. So we start seeing places like Minnesota and Seattle experiencing high levels of death during heat events because they are in a moderate climate and their built environment has been built with the idea that maybe air conditioning is a voluntary, nice to have thing as opposed to a must have in order to make it through the summer safely. So then you add to that picture that there are people living and working in rural areas that are less equipped than their neighbors in urban areas to adapt to this new climate reality. And that's because of kind of this layering of, you know, your individual, your social, and your environmental vulnerabilities. And so that's what we were particularly interested in looking at in the Green River District, both looking at it from, you know, a rural versus urban perspective, but also to see for each of those 7 counties in our region, what was the difference in terms of vulnerability and what were the types of climate hazards that we really wanted to focus on addressing through public health intervention. And so I'm going to walk through the 5 main vulnerable characteristics of rural populations sort of in general to give us kind of a similar place of starting to then start looking into more specifically at different climatic events. So first we look at demographics. People living in rural populations, and again, this is in the United States, tend to be older, less affluent, less well-educated, and with higher levels of unemployment. And so for those of you who are kind of come from a public health background, those are sort of, I just listed out this, the underlying social determinants of health. So these are the aspects of your, you know, your personal and societal surroundings that can make you more or less vulnerable to any kind of health stressor. So we see that that is something that in general, on average, rural populations confront in the United States. Secondly is their access to care. And that's both in terms of how few and far between different hospitals are or clinics. It also has to do with the fact that rural populations in the US tend to spend a higher proportion of their income on medical services than urban populations. Thirdly, health outcomes. Rural populations have a higher rate of age-adjusted mortality, disability, and chronic disease from in comparison to urban populations. And again, that's probably partially connected to the first 2 of these vulnerabilities. And then if we think about the built environment and land use, you know, the definition of a rural area is that the buildings and infrastructure are fewer and farther between. And so what that means is that when a road or waterway, which is something I'll be talking about in a little bit more depth, becomes impassable for some reason during a climatic event or afterwards, there may not be a way to get to that isolated population, or it might be much more difficult. You might have to use things like helicopters to get there. Whereas in urban areas, generally it's easier to find a workaround whenever there's an infrastructural collapse. And then finally, environmental exposure. So on average, rural populations are more exposed to toxic chemicals than urban areas. Of course, environmental justice communities in urban areas have a quite high exposure, but rural areas in many cases kind of are comparable to that. And maybe that's not a narrative that is shared as much as it probably ought to be. And in particular, these are chemicals that are used in the course of agricultural and industrial activities. So things like pesticides, herbicides, and fertilizers. So I included this slide for members of the audience who are interested in doing this similar kind of analysis in their region, to just give you kind of like a peek behind the screen about how we went about doing our project. Because what we were doing, as I mentioned before, was trying to fill a research gap. Then the immediate question became, well, what do we do if we don't have like specific information that's already been done? This was a short project. We were using completely secondary data sources. We weren't producing data ourselves. So what we did was we started out by looking at the reputable reports that had been put out by international and national sources. And in particular, we looked at the National Climate Assessment of the United States. And a portion of that goes down into the southeastern United States. So we were able to kind of take a look at what are the major vulnerabilities within the United States, what are the major climate hazards, and then what does the climate assessment say are particularly challenges for the southeastern US, but that's quite a large part of the United States. So then we needed to refine down to Kentucky, and we were lucky enough to find a number of reports that had been done not necessarily looking at public health, but looking at things like agriculture that were looking at Kentucky as a whole. And within those reports, we were able to find maps and graphs and tables that divided the state either into regions or into counties. And so that was a way for us to start kind of honing in on our part of the state. And then because we were working with the health department, we were able to make connections with the state health department, with the University of Kentucky, with the state meteorologist, and with other local experts who were able to both give us data that was not publicly available and also able to validate our conclusions after having looked at the more publicly available research. We used all of that information to develop metrics, and in public health, we call them indicators. So when I say indicator, what I'm talking about are metrics that have a specific scientific definition, and we tried to use indicators that had the same definition at multiple geographic scales so that we could compare what we were finding at the county level to what was going on at the state level and the national level, so that we could do some sort of benchmarking to understand where these different counties sat in comparison to their peers, in comparison to the state, and in comparison to the country. And then finally, what we used this information for, as I said before, was to help incorporate climate change into an environmental health section of the community health assessment. And that gave the health department the ability to start having conversations with residents about understanding what their experience has been around these climatic events, and what they thought the priorities ought to be. It also gave them, because we were using reputable kind of validated metrics, the ability to identify benchmarks and goals that they could put into the community health improvement plan and see whether the interventions that they were putting in place were actually effective. And then finally, we were helping to seed this portal that was developed by the state health department that's called the Kentucky Enviro Health Link portal. So taking all of that information together, we used a methodology that was developed by the U.S. Centers for Disease Control and Prevention that's called the BRACE framework. And that framework helped us hone in on 3 leading climate-related hazards for the Green River District. And so I'm gonna walk through each one of these hazards to give you an understanding about how each of them is impacting the economy, the health, and the vulnerable populations within this particular region. So starting out with the extreme heat, the main economic impacts of heat events seen historically in this area was a strain on the electrical grid, and that was because of increased air conditioning demand during extreme heat events, and then also reducing the crop yields and livestock yields, as well as the productivity of the agricultural and the industrial workers who worked either outdoors or sort of in a semi-outdoor setting. In terms of the health impacts, we saw that there was an increase in hospital visits and mortality. And the kind of one thing that's a little bit different about rural areas versus urban and heat injury is that there's a larger proportion of people who end up in the hospital during heat events who are outdoor workers in rural areas. And so that means we're talking about a lot of men who are kind of in the 20 to 60 year range. And that's a big difference from a lot of the research that we see from urban areas, where you see a large percentage of deaths happening amongst the elderly and the very young. And again, it's just something to be mindful of in thinking about the difference between urban and rural settings. Something that was more similar between the two sets of populations was that we did see an exacerbation in chronic disease conditions like heart disease, asthma, stroke, obesity, diabetes. And because rural populations tend to have a higher burden of those diseases, then it kind of makes sense that they would have a disproportionate burden during those heat events. And then in rural areas, we also see a higher percentage of housing that is maybe not up to standard. And as a result, during extreme heat events, they might be more likely to either lose air conditioning. There was a higher percentage of not having air conditioning in some of these counties to begin with. And so that was an exposure to heat that was seen as a particular difficult situation for these counties. In terms of the vulnerable groups, we saw a pretty similar kind of array for what you would see in urban areas. So children, the elderly, pregnant women have physiological reasons why they tend to have are at higher vulnerability to exposure to extreme heat. And then just like Natasha was mentioning, the minority populations and populations experiencing poverty. I'd say one thing that is particularly interesting or difficult about rural areas is her comment about non-Americans or citizens of other countries living in the United States. One of the difficulties that we had was that there's not really a census of undocumented farm workers in Kentucky, at least not that we found, and that those groups have kind of two. Well, they're vulnerable in a number of ways. One, they're vulnerable because of their situation is not being documented, so they don't have the ability to advocate for themselves. Secondly, they may have a language barrier, so they may not actually hear the news that we're in a certain situation in terms of an extreme heat event, and it's important to take care of yourself. And then thirdly, they're the ones who are more likely to be working outside. So they're going to be more exposed or in industrial settings. And so that was something that we weren't quite able to address, but we definitely identified that group in particular, as well as the homeless, as being highly vulnerable to extreme heat. So secondly, looking at drought. Drought is an interesting one because it relates to both extreme heat and flooding. So it kind of bridges the other two. And you see very similar economic impacts that we found related to heat and drought in terms of reducing reducing livestock yields. I think that the thing about the economic difference or challenges that's a little bit different in this area was that many of the, much of the commerce that goes on in this particular area goes along waterways through barges and goes in the direction of the Mississippi River and moves along that way. So when you have a drought and the water level goes down, then there are delays in shipments, which causes economic distress. And because droughts are more long-term, we move on to health impacts, we saw mental health as being a major concern because of those economic issues related to drought. The other thing that is a little bit different about drought and the health impacts was that because of when you think about reducing the volume of water in those waterways, those were also most of the water sources for potable water was surface water in this area. And so what you find is that if there's pollution in that water, or then that pollution becomes more concentrated. So there's less access to potable water. And then you also see increases in waterborne disease because those pathogens like to live in warm water. So as there's less volume of water, the water warms up more. And so it's easier for things like harmful algal blooms and other types of waterborne disease to survive. And it causes a big strain on the water system to clean out those types of contaminants. Again, the vulnerable groups are pretty similar. You'll see that across all three of them and for similar reasons. And just in the interest of time, I'll move on to flooding, but I'm always happy to talk more about drought to anyone who would like to. Many times droughts end with floods. So we see that these three climatic events, while we can talk about them as three different things, many times the drought is exacerbated or even sparked off by heat events that are kind of chain heat events. And then when the drought finally ends, it's because there's a major precipitation event that causes flooding. So the economic impacts of those flooding are related to property and infrastructure. Again, we end up with delays in shipments. And in this case, it's not just waterways, it would be impassable roads as well as rail. And then of course, you're already having trouble with your crops and your livestock because of the heat and the drought, and then they go and get flooded and you lose your whole crop. So that's a big problem in terms of the economic impacts. And again, you have mental health concerns here, both related to the economics, but also because of displacement. A lot of the time, when you have a major flooding event, the displacement of the population can be for months or even years. And like Natasha was saying, during Katrina, there's been some interesting research showing long-term displacement and the long-term mental health deterioration of populations who were had to move away from their home and maybe never went back and lost those social ties. In terms of the health impacts, they were pretty much the same as what Natasha mentioned before in terms of risks of drowning and injury and death because of the flooding. I'd say the one thing that I would add is that during these power outages, you do see an uptick in carbon monoxide poisoning because people are using generators to provide air conditioning and warm temperatures and heating and cold temperatures. And that if they use them inside, then there's always an uptick in people ending up in the hospital because of carbon monoxide poisoning. Again, we have a risk of exposure to contaminated water. In this case, it's usually because of, say, fertilizer, pesticides, or other types of contaminants getting into that flood water. And then finally, in terms of vulnerable populations, it's pretty much the same group of people plus people living in floodplains who tend to be, I'd say not all of them, but there's definitely, particularly in the area that we looked in, the highest proportion of the people living in floodplains were minorities and people experiencing poverty. So we combined all of this information that I just shared with you guys and developed 28 climate and health indicators, and then mapped them across all 7 of the counties and then looked at them as a whole for the whole district and compared them to Kentucky and the United States. And you can see here that they're kind of divided into sections. So the first thing that you want to do when you're trying to map out vulnerability for a region is to understand what are the major environmental exposures. And you'll see here that we put all of the ones that we addressed in that red category, the high category, because, you know, there's only so much resources to go around. So we decided to focus on the ones that were the most high risk. We then looked at human health outcomes related to those exposures, population vulnerabilities, which is what we were just walking through, and then the environmental vulnerabilities, things like living in a floodplain or living in stressed housing. The way that this kind of color coding worked was to put it in the high risk category, the indicator in that county had to fall short of both Kentucky and US as benchmarks, their averages. And that's the reason why we chose indicators that were the same definition across multiple geographic scales, was so that we could create a benchmarking toolkit like this. If it's in the kind of moderate risk category, the orange, then that means that it falls short of either Kentucky or the US indicator, but not both. And if it was seen as low risk, then that county was doing better than Kentucky and the US. And so the idea behind this chart was to help the health department both communicate with the community to help them understand, you know, these are the major climate hazards that our communities are experiencing. And then these are the most high risk aspects of the impacts of those exposures, so that we can then as a community help prioritize our limited resources and make use of them to the best effect. And in terms of the outcomes of the project, in addition to what I explained sort of at the beginning, we were excited to be included in the next round of the National Climate Assessment, the NCA4, where our report and the article that came out of our report were cited as one example of an attempt to fill that gap in research around how do you identify what the risks are that are specific to a rural area and what can be done about that through public health. And I'd just like to close by acknowledging my co-authors and clients at the Green River District Health Department and the many people who helped make this project possible. So thank you. And I will put the link to the report, which is publicly available, in the chat.
Okay, welcome back, everyone. Thank you for hanging with us for our final speaker, Dr. Gradia Huerta Montanez from the University of Georgia College of Public Health. And please go ahead and begin your talk.
Great. Hi, can you hear me well?
I can, thank you.
Wonderful. I'm very grateful to Sierra Club for inviting me to present today about climate change and how extreme weather events impact our populations, particularly children's health. In my presentation, I'll be applying many of the concepts of climate change and social and health determinants that Natasha and Adele explained in their presentations through the lens of our experience in Puerto Rico with extreme weather events. I'm a pediatrician with training on environmental health, but I'm also an islander born and raised in Puerto Rico. Puerto Rico, officially the Commonwealth of Puerto Rico, is an archipelago of islands located in the Greater Antilles. It was colonized by Spain in the early 1500s, and it became a US territory in 1898, and would have been US citizen since 1917. Puerto Rico is one of the most beautiful places on earth. Obviously, I'm biased. With the perfect weather year-round, our culture is very rich, fed by many talented people. And to us, family is first, and we love getting together to celebrate life, and I'm extremely proud of my heritage. But just to give you a background about myself, I started my work as a clinician, as a pediatrician in the outpatient setting, offering services to underserved Latino communities in the state of Georgia. And when I returned to Puerto Rico, I worked in the hospital setting. And in 2012, I transitioned to the world of public health and environmental medicine. And when I completed my fellowship in 2015, I started working in scientific investigation when I joined a consortium of NIH-funded environmental research projects that evaluate environmental exposures in the health of pregnant women and their infants in Puerto Rico. Perhaps many of you with environmental conscience have somehow experienced what I like to call awakening moments. Those experiences that have made you aware of the sense of urgency of the environmental and climate change crisis and how it is endangering our health and our well-being. And I certainly have had those moments since childhood. My first environmental awakening moment was in elementary school, actually, when scientists have been warning about the accelerating of the warming of our planet due to human activity for decades. So these topics are not new, but I attended a school for underserved communities in Puerto Rico, and there I learned about geology, acid rain, the ozone layer, and how hydrofluorocarbons were damaging it. This experience and its ramifications in my life formed my conviction that children need a nurturing educational system that provides all of them with hands-on experiences in the STEM fields, the science, technology, engineering, and math from early on. My second and perhaps the most significant insight memento was when to environmental awareness was when I had my first child. Motherhood made me keenly aware of what was around my baby, in the air, in the water, in the soil, in the food. And then with my second and my third children, the environmental advocacy became a family matter. My third big learning moment was the experience of working at an underserved human health services clinic in Gwinnett County in Georgia, where I could see firsthand the conditions of the immigrant children and all the potentially adverse environmental exposures that they had and all the struggles they had to endure due to profound inequities. And the fourth formative lesson for me took place when I worked in the clinical management of children suffering from lead poisoning in the western town of Arecibo in Puerto Rico. And this poisoning had its origins in parental occupational exposures occurring at a battery recycling facility. And many of you may have noticed that vulnerability is the common denominator in all of these stories. We're all vulnerable, but it is fundamental that when we talk about pollution and climate change impacts on human health, we highlight and take into consideration the fact that even though we're all impacted, those disadvantaged groups with marked social determinants of health suffer disproportionately, as Natasha mentioned, more from adverse consequences brought on Earth by our actions as humans. So the burden is unequal, and those that contribute less to climate change, to the climate change problem, ironically, are the most impacted. And the groups with the lowest carbon footprints suffer the more from the consequences of climate change. It has been well documented that climate change broadens these inequalities and worsens the social and health determinants. Therefore, populations with a higher baseline risk, historically under-resourced communities, and marginalized populations are more impacted. Pregnant women, children, and people with special healthcare needs also are particularly more susceptible and vulnerable. And climate change is also an issue of transgenerational injustice because our actions today are degrading the planet in which younger and future generations will live. So our mess today is their problem tomorrow. We must understand that children are not little adults. Infants and children are more vulnerable for several reasons. They breathe more volume of air per minute. They eat more food and drink more water per kilogram of body weight than adults. And according to their developmental stage, they display behaviors such as hand-mouth, which may put them at increased risk of environmental exposures. Their body systems experience tremendous changes during their prenatal period and the first years of life, as Adele mentioned, with specific windows of vulnerability in which the susceptibility of the developing organs to toxic insult is heightened and can result in more damage. Human brain development is particularly susceptible to environmental influences, and the adverse consequences can be devastating and long term. All these behavioral, psychological, psychosocial, and health needs of young children make them also particularly vulnerable to extreme weather events, which are associated with global warming. The American Academy of Pediatrics has highlighted that extreme weather events place children at risk for injury, loss of or separation from caregivers, exposure to infectious diseases, and a uniquely high risk of mental health consequences, including post-traumatic stress disorder, as it was mentioned before, depression and adjustment disorder. Thanks to environmental health research and those working to appraise and disseminate the findings, medical professionals, others in the care of continuum of children, and policymakers have wide-ranging resources to better protect pregnant women and children from exposures that may lead to cancer, learning disabilities, and behavioral problems, and neurodevelopmental deficiencies, asthma, diabetes, and cardiovascular disease. And yet some of these conditions that I just mentioned are prevalent among our children. In Puerto Rico, for example, 14% of children and adolescents have asthma. This is the highest, actually double the prevalence in the United States, mainland United States and territories. Despite commendable improvements, Puerto Rico continues to have one of the highest rates of premature birth in the United States. And science is increasingly showing that both of these conditions are influenced by climate change. The same pollution resulting from fossil fuel burning that is driving climate change is also decreasing the quality of the air we breathe with particulate matter, ozone, and other greenhouses. So in addition to the increase in temperature directly deteriorates air quality. And that has been shown in research many times. We should redouble our efforts to translate this knowledge to our communities, helping them overcome those health inequalities, which influence the extent of climate change adverse outcomes and sadly are still so prevalent in the 21st century. We must heed sound science and the precautionary principle when appropriate to protect our children. An estimated 90% of the excess heat caused by greenhouse emissions is trapped by ocean waters, becoming a source of energy that results in hurricanes that are stronger, develop faster, and last longer. We know that storm surge and flooding are more damaging, are the more damaging components of hurricanes. And the rise in sea level, coastal erosion, and disruption of the natural cycles of sand movements is exacerbated by human actions of invasion and misuse of our coast with irresponsible construction codes, for example. This is an example in Puerto Rico. We certainly need more people, many more people, to have those awakening moments that I was talking about. And all this brings me to my fifth learning moment. On September 20, 2017, 3.5 million Americans experienced firsthand how a single climate change related event can bring a devastating combination of effects that put all communities, particularly children and other vulnerable people, at risk of short-term and long-term adverse health outcomes. Every year, thousands of Americans have the trauma of living through weather-related disasters which cause much morbidity and mortality and profound infrastructure and economic damage. Just look at what happened with the record-breaking hurricane season last year that Natasha mentioned during a pandemic on top of everything. It was a season that started earlier with 9 rapidly intensifying storms and the most ever recorded impacting Louisiana, Mississippi, and Texas. And again, we're all vulnerable, but many communities and groups are more vulnerable for many reasons. Take Texas, for example. Petrochemical facilities, refineries, chemical plants that are prone to structural damage during these events with the release of pollutant chemicals, for example. And then look at Puerto Rico with the heaviest concentration of Superfund sites per surface area. I can attest that this vulnerability goes beyond what words can describe. Despite our experience as islanders in the tropics, we could not foresee what was ahead in September 2017. With less than 2 weeks to recover from Irma, Maria hit as a Category 4 hurricane with sustained winds of 155 miles per hour and remained over Puerto Rican soil for what seemed as an eternity, traveling at 10 miles per hour. Those excruciating hours and the following several months are still fresh in our psyches and our hearts as we are still mourning the loss of thousands of lives and have many reminders of that event around us still on the island. There were reports of people falling from their roofs during the preparation for the event, injuries due to the destruction debris. And thousands of homes were destroyed down to their foundations with the resulting homelessness. Thousands of homes required blue tarp roofs, and still today, over 3 years after this event, we have fellow citizens with blue roofs over their heads. Children living in shelters were at increased risk of gastrointestinal diseases, heat dehydration, scabies, respiratory illnesses, and lack of safe sleep, safe feeding, and hygiene facilities. Children with special needs and infants less than a year of age were at an increased risk for morbidity and mortality. In another resemblance to the COVID pandemic, children's lives were completely disrupted with schools and daycare closed for extended periods due to the destruction, lack of healthy spaces to grow, develop, and play, and lack of consistent preventive care. The destruction of bridges and roads and the complete collapse of telecommunications took months to restore. And it's still taking, and it's going to take years to rebuild. We still see evidence of what happened almost 4 years ago. Lack of medical access, not only because clinicians were victims of the devastation ourselves, but also because patients had no means to get to the hospital. The hospital sustained flood damage or lacked electricity. The lack of refrigeration made it difficult to maintain medical grade storage conditions for vaccines, and a national shortage of IV fluid injection bags that lasted for months. And it also affected the mainland, was the consequence of the devastation caused by the hurricane to pharmaceutical facilities in the town of Jayuya in Puerto Rico. The lack of power for over 8 months in many parts caused very extreme situations, from children unable to get a nebulizer asthma treatment, for example, to situations in the immediate aftermath, such as surgeons having to finish operating on patients with the help of cell phone flashlights because the hospital generator malfunctioned. These challenges at healthcare facilities are evocative of what happened in New York City after Hurricane Sandy. Using a power generator for months proved to be very traumatic. I don't want to go through that again. The noise contamination was awful. The decrease in air quality outdoor was evident. And also the indoor air quality was affected. And those were just some of the collateral effects of the use of generators for 8, 9, 10, 12 months. Without electricity, we had no way to refrigerate our food, increasing the risk of food poisoning. So ice bags became a precious commodity. This translated to standing in a line, as you can see on the image, sometimes under the sun for 8 hours, just to buy a rationed bag of ice. Thousands of people made such lines to buy gasoline or diesel to fuel those generators that we needed to survive. And the acquisition, transportation, storage, and the use of these products posed a hazard to people not taking precautions because of the lack of knowledge, or just they simply didn't know how to make this in a safer way. And many sought hospital care due to intoxication or injuries from improper use of electrical generators. Finding food also became a struggle, especially at the beginning, because our food distribution system was completely disrupted. Many times the shelves were empty. And in addition, many of the local harvests were completely lost. For example, our coffee harvest and crops. The lack of clean water was another risk that lasted months. Initially, we had no water service, which led to some of us buying water that was being distributed in unofficial truck tanks, to later find out that this water could have potentially come from a Superfund site located in the town of Dorado. These were the kind of situations that we were living. And what about the subsequent use of bottled water for months with increased exposure to phthalates and its effects on pregnant women and their infants' health? Similar to the current pandemic, there was an increase in solid waste, with all this plastic ending in landfills because of lack of an efficient recycling system. And the same thing we're seeing with the pandemic, because of all the carry out, the use of plastic, the use of the face mask, etc. Disposing of these solid waste is becoming a challenge. For many, our research projects represented the only source for safe, clean water and for other basic needs through our community engagement core. So this was a way in which our research projects transformed into centers of care and support to the communities that we conduct our research in. In some places, the flooding led to stagnant waters with chemical and microbiological contamination for weeks. And this water hazard caused growth of mold in residences and buildings, putting at risk the people with asthma, allergies, and the immune compromised. Increased vector-borne illnesses is another threat that we faced. There was a leptospirosis outbreak without an efficient surveillance system to help mitigate the risks, and with authorities reluctant to properly frame and address the risk. And this devastation led to the displacement of approximately 400,000 people from the island, mainly to United States mainland, to the mainland. And these fellow citizens became what we call climate refugees. Many children endured traumatic separation from family and other important relationships in their lives. So even though we're citizens, also going to a place in this kind of displacement, forced, maybe without the intention of leaving, but they had to be able to survive, put them in a very strange situation. And this bleak situation without an end in sight bred hopelessness, exacerbated by a poorly coordinated and resourced response from the local and the federal governments. One factor stressing the federal response was a slew of major disasters that preceded Hurricane Irma that same year. Therefore, this climate change menace can engender a reinforcing negative feedback loop, breeding larger disasters, hampering the recovery and weakening resilience. Even in the absence of major disasters, the steady rise in average global temperature results in a shift in baseline, and we kind of get accustomed to worsening conditions. As David Roberts recently wrote for Vox.com, we calibrate our expectations to the world we were born into, irrespective of what came before, and in so doing, we unintentionally discount the severity of threats to our well-being. The toxic stress caused by extreme weather events has the potential of leading to pathological changes in children's brain anatomy and physiology. These changes can make children more susceptible to stress-related disorders in the realms of mental and physical health. The wildfires in California, some that also occurred in 2017 and that have been destructive since, and last year in Colorado and Utah, present yet another concrete example of how climate change can lead to morbidity and mortality in our communities and causing the tragic loss of lives, family displacement and homelessness, and decreased air quality that can reach hundreds of miles away. There, as happens in disasters elsewhere, children's mental health is affected with the trauma of loss and toxic stress. So this suggests that interventions that provide consistent, predictable, and nurturing care help to stimulate positive adaptation and prevent poor outcomes. So there is hope. But we must focus on providing that opportunity to all children. Climate change repercussions on human health extend well beyond the acute phase of the emergency. And we can attest to that in Puerto Rico. And it can even have, as I mentioned, transgenerational effects. And in, for example, as the means of epigenetic modifications. What happened during Hurricane Maria was also a lesson on how ill-prepared we were to respond to emergencies. Now the world is facing a pandemic that has shown us once again how important it is to take preparedness seriously. Needless to say that these are very trying times. Climate change is a real global emergency that is unfolding right before our eyes during this pandemic, as evidenced, as Natasha mentioned, by the described association between increased air particulate matter with increased COVID-19 mortality. And yet, tragically, it has been politicized and used to polarize our societies. The similarities between both crises, the pandemic and climate change, are striking, and we must learn from these lessons if we really want to prepare. The science demonstrating the association between climate change and adverse health outcomes is strong. Steady increase in the number of days with temperatures above 90 degrees, more hot nights per year translating into decreased quality and quantity of sleep, increase in diarrheal illnesses and emerging infectious diseases, including those infections caused by vectors as mosquitoes and ticks, as was mentioned before. And we lived through that in 2016 because Puerto Rico was the epicenter of the Zika pandemic. Longer allergy seasons, adverse birth outcomes, water safety and food insecurity issues, decreased nutritional value of the crops and seafood because of the changes in the macro and micronutrients because of the increase in temperatures, increased pollution, as it was mentioned, and increased cardiorespiratory and lung disease related to decreased air quality and heat are some of them. Physicians are increasingly aware of the adverse health effects of climate change and are very interested in and feel responsible to inform their patients, families, and policymakers about this. Many physicians report that they are already seeing health harms from climate change among their patients. It is essential that our health systems translate what the science is telling us about the adverse health outcomes related to pollution and climate change. And this is why there's a growing national effort to incorporate environmental health and climate change curricula into medical, nursing, and other health-related careers education. And as a society, for the same reasons, we must make sure that environmental and climate sciences research are well-funded and supported. Governments and societies must also promote and support the growing awareness and efforts that some hospitals are making to reduce the climate footprint of inpatient healthcare systems. The hospital system is among the heavy emitting sectors with approximately 10% of carbon emissions in the United States, with more than half coming from energy use. Knowing that the current warming trend is the result of human activity, means that we are causing the problem, but we're also having the solutions. So the solutions require sacrifice, collaboration, and collective will. Fuel combustion accounts for 85% of airborne particulate pollution and almost all pollution by oxides of sulfur and nitrogen. And fossil fuel combustion is the major source of the greenhouse gases that drive climate change. So pollution prevention will slow climate change, and climate mitigation will reduce pollution and disease. So public policy must all be directed to pursue efforts to limit the temperature increase to 1.5 degrees. We're also seeing more awareness of how climate change is harming all of us. In 2020, for example, we founded the Puerto Rico chapter of Clinicians for Climate Action, affiliated to the Medical Consortium for Climate and Health. And so we need public policies centered in climate action that considers climate change as a public health emergency, and we're working towards that. The Sierra Club in Puerto Rico is leading a collaboration with multiple institutions, including NGOs, local government, and community-based organizations, to increase awareness through a citizens' climate declaration and a massive media tour to invite all communities to get involved in climate action and demand the government to support preparedness and climate mitigation and adaptation efforts to confront this climate change crisis, to rebuild an infrastructure that is climate resilient and sustainable, and to practice public policy that protect ecological and human health. They're working really hard in that effort. We're all concerned, we're all suffering, and our world needs climate leadership. All these crises have highlighted the profound injustices and inequities that we're ignoring in the day-to-day economic, social, health, racial inequities. With COVID-19, we again witnessed how we're not all on the same boat. We must prioritize climate solutions to secure all people in their communities. Each one of us is called to become climate leader. And health and quality of life for all must be at the core of our efforts and must be the driving force. This can only happen if we face our moral responsibility, trust science, and act with compassion and kindness. Each one of us is here because other fellow citizens are serving as essential workers, caring for you and for me in the front line through this pandemic. They're the perfect example of emergency leaders. And they have shown us with actions that to lead, we must sacrifice and have empathy. That's what we need. We must support our public health systems and fine-tune our preparedness and planning efforts. And we cannot accomplish this without respecting science. So what is next after all this that we've presented? How can we put our minds and commitment together and make gains in the science, practice translation, policy formulation, and evaluation of our environmental health portfolio? I reflect on my role as a mother, pediatrician, researcher, and citizen. So much to learn, so much to do. But one thing is for sure, we cannot do this alone. We must collaborate. And there is hope. Discussion panels as this one present an opportunity to generate discussion, identify new ways to collaborate and share ideas to fulfill our noble goal of an environment where children can thrive. I leave you with one quote from Rachel Carson: "The human race is challenged more than ever to demonstrate our mastery, not over nature, but over ourselves." Thank you.
Well, thank you so much to all three of our presenters. So much to absorb and digest there. We have about 15 minutes left for questions. So what I'm going to do is just keep an eye on the chat, and I've got a list of a few people who have posted questions. The first one was David Hyman. Are you still with us, David? He may have dropped off, actually. But Elizabeth sort of brought up the same question about some of the connections between COVID and climate and race. Elizabeth, do you want to voice that question again? Are you still with us? I think Elizabeth may have dropped off, actually. Okay. Well, as I said, if you do have questions, you have, I think to our presenters, I think that's a really important question. Do you have anything to add? There were some of you responded in the chat, but do you have anything to add about that connection, that coming together of race and climate and COVID?
Yes, I love Adele's response on these questions as well. And look forward to hearing from both speakers. These are related, important questions, and it speaks to systemic racism and how it plays out, as Adele very eloquently pointed out. And what's important is that in the studies that are showing disparities, these major landmark studies are adjusted for income. They are adjusted for other socioeconomic factors, education, otherwise, and it still holds up that there's a disparate burden when it comes to climate exposures. So it causes us to look to what else may there be? Me in environmental health, we say, well, there is an environmental relationship for sure, and we know that that relationship exists. So it comes to a place matters perspective, but there's so much that goes into place as explored through systemic racism of why people live where they live, what infrastructure challenges are where people live, what exposures are burdening people where they live, and so forth and so on. But the data has shown a very strong linkage to race and exposures. Dr. Robert Bullard, the father of environmental justice, first found that the most powerful predictor of where polluters are located, so toxic emissions releasing facilities, where they're located is race. It's not income, it's not education, it's race. And then they came back. I've actually been trying to figure out the time frame of which they came back, but either 10 or 20 years later, they came back and looked at this again, and it's still race. This is a very prevalent predictor of what people are exposed to. So it's certainly important to look at it as a whole and to understand the ways that systemic factors in our society continue to contribute to populations being more heavily burdened by air and other exposures.
Adele,
Yeah, and I think I would just add to that. I'm pretty sure there have been some studies in China as well about the relationship between air pollution and COVID mortality. So, you know, just to add to what Natasha was saying, one of the things that can be difficult when you're doing research in environmental health in the US is that our country is so segregated. And as Natasha did such a great job of explaining, there's so many risk factors clustered in areas where certain people live that it can be hard to tease out what you're measuring. And there kind of comes a point as a researcher where you kind of like start questioning, why am I even doing this research? Like, it's so obvious that there's a problem. Let's try and start working on fixing the problem, which is one of the reasons why I appreciated Elaine's question later about, you know, well, what can we do about this? And it comes to mind, like I did a health impact assessment in Houston a few years ago, looking at highways, which are not in Houston, but in many parts of the country are the major contributors to air pollution. In Houston, it's the port and the petrochemical complex around the port. And we went into a neighborhood to say, you know, we're doing this project and it has to do with this highway, and they're going to expand this highway literally to go to Gredia's comments across the street from an elementary school. You know, these are some, I'm an architect, so these are some design things that you could maybe think about to, you know, protect the the school. And to Natasha's point, one of the things we talked about was planting trees. And the people in the community were like, okay, but what are you going to do about the chemical plant that's down the street, right? You know, like there's kind of a point where it becomes a little bit crazy when you try and separate out one little thing from one other thing when we're talking about a community that Dr. Bullard, you know, calls sort of the sacrificial, like sacrifice zones, where these are communities that have just been put in the middle of so many different challenges. And COVID is just sort of, I think, shown a spotlight on them in a way that climate change, sometimes it's hard to show that spotlight because it's both long-term and also these very intense events like Harvey, but that then all the conversation, the politics becomes, well, was Harvey connected to climate change? Was it not? And that kind of moves the conversation away from the important question, which is, why are these communities the way they are and what can we do to help them? And I think COVID has done a good job of helping us focus our conversation on that because of the fact that it's an infectious disease pandemic as opposed to climate change, which is more of an environmental pandemic.
Gradia, did you want to add anything to that?
Yeah, that's what we see we see that in our research projects through our community engagement efforts. How do you translate the science to the communities so they learn how to better protect, for example, their children? And so it's a monumental task to be able to reach all the communities in need. And obviously it's the same, you see the parallelisms between COVID-19 pandemic and the climate change, and you see the same things are putting these communities behind. And so we really have to work on finding what really works. And I think communication is key. We need to communicate with these communities with, as I mentioned, evidence-based, and in the case of clinicians with the best clinical practices, and we need to outreach them. In Puerto Rico, it's been published that Puerto Rico is an environmental justice island, like the whole island, the whole, the 3.1 million now, 3.1 million approximately citizens are part of this environmental justice issue, just by the fact that, you know, we have the heaviest concentration of Superfund sites. So definitely they're going to have the possibility of having families with children living these sites is higher. Obviously, when these extreme events hit, these Superfunds are not infallible. They're going to be structural damages and the possibility of increased exposures. So what we're doing at our chapter of the American Academy of Pediatrics is trying to educate them in an ongoing effort, not right before the hurricane season, for example, but let's do it year round. Every time you see your patients for a well-child checkup, let's talk about preparedness. And don't wait until it's May, right before the hurricane season starts, to start talking about this. So it's something that we're training our medical students and our residents and our clinicians in practice to start doing with their patients, talking about environmental issues, because everything is kind of the big puzzle, and everything is kind of a little piece of that big puzzle. And I think this pandemic, at least for us in research and clinicians, is making us look at the whole picture. And I think it all comes down, we need to take care of these vulnerable populations. We're all vulnerable, but there are people that are suffering more, and there are things that we can do in a day-to-day clinical practice to help these families. We definitely can. For example, we created this video on how to prevent lead exposure. We know that kids are being more exposed to lead during the pandemic. They're spending more time in their homes, and if there is exposure to lead in their homes, obviously they're going to be more exposed. And the effects of lead exposure are long-term, are lifelong, and is 100% preventable. So we need to make more efforts about that. So we actually made a video. It's an animated video. It's 4 minutes, and people can actually, you know, scan a barcode to download the video in their smartphones. And that's part of a more detailed engaging way of doing anticipatory guidance and education on environmental issue, that people can do things about it to help their kids be safer and healthier. So that video is just an example of things that you can do now in this digital world and social media world to outreach people. So we have no excuse to give the communities the education and the tools that they need. And I think clinicians have a central role in this task.
Great, thank you. So I would ask, one thing that I've heard from all three of you in a way is this whole idea of learning as you go, and keeping, sort of, I would think of it, with the phrase action research. I don't know if that's a common phrase in public health sphere, but it seems like a really important lesson, and as climate response to climate is going to be new and constantly evolving. So it seems like you've all made great use of that. Any thoughts to share about as we think of as we think of creating climate and health plans in our states, here in Vermont where I am, we're getting started on that. Do you have any thoughts regarding that?
Well, I must say again, communication. There are other countries that are doing things that are working for them, and we need to start looking at what other people are doing that it's working, and sharing what we're doing that may be working. And again, when you mention about, it's kind of an evolution process. Personally, in the different, work that we do, but then also as a country in the United States, we're evolving, and we need to move, and we need to move quickly because time is running out. So again, we see the parallelism with the COVID-19. Every single day as a clinician, I had to be, to sit down and read what it's being published, even if it's preliminary data that was being shared, just to learn how to better cope with this and help my patients and help the communities. Same thing here. In a personal all the way up to as a country level, we need to continue educating ourselves with the science and applying, and then communicating with other people. Let's share what we're doing the same way we're doing this here, and learn from each other, and advocate for our citizens, advocate for our patients, advocate for children.
Yeah, and I would just add to that that two of the things that really came out of the Kentucky project were that how important it is to pay attention. Like Natasha did such a great job of talking about how different locations have different needs. And to your point, Stephen, one of the things that can be a little bit difficult for people to get their heads around about climate change is that using historical information is not necessarily sufficient. And so it's important to think about how things might change in the future, and sometimes in a very disruptive way, and maybe unexpected way. And so, but having said that, if you think about the kind of group of people that are living in a certain area, and the environmental, like the natural and built environment, as well as the social environment characteristics of that place, that will help prioritize action that will be different from, if you think about our 7 counties, the recommendations were different for each county, even though they were all rural counties, because some of them were more agricultural, some of them were more industrial, some of them were right next to the river, some of them were not next to the river. Some of them had a whole bunch of African Americans living in really bad housing right next to the river. That's a really important risk factor that county needed to focus on, right? Others were an old industrial town that needed help with its homeless population. So I think it's really important to look at, do some ground truthing and understanding what the needs are, and then prioritize based on that. But the other thing, oh gosh, and now I've forgotten my other point was, which was really much related to that, and it was important. But it's oh gosh, I'll think of it in a second. I'll let Natasha respond, and I'll think of it while she's talking.
Oh, thank you so much. I realize we're at time. I have a little story I want to share with you. Thank you everyone for holding on to the end. I want to compliment what our two speakers have shared. And if you don't mind, I would like to share a photo to be able to do this. I want to compliment what's been shared on the need of continuously reevaluating, following the science, and the importance of that. And I want to affirm you in your calling to address climate change and the unique skills that you bring to this. And just want to share you this story that encouraged me and is really foundational in how I move forward in my career, and what I feel is my calling to work in this space. And so in 2016, and I don't want to be too political, in 2016, the American Public Health Association was planning towards a 2017 year of climate change and health. And at the getting close to the end of 2016, the political landscape changed in what was an unexpected way for the planners of this. And so there was a pause for a moment where the group talked and said, is this something that we should continue with? Do we want to do something that will immediately put us on the opposite side of this administration, in essence, is the question. And Dr. Georges Benjamin, you see him here on the end in the gray suit. He said, and quoting Dr. Martin Luther King, "It is always the right time to do what is right." And I want to leave you with those important words. It's always the right time to do what is right. What you see here is a photo of our staff with Vice President Al Gore, which is one of the greatest days in my professional career. But that decision to do what is right led to this great moment where we were able to have a big climate and health summit that his gravitas really pulled a lot of people into the climate and health space and saw climate as a health issue and an equity issue. So it's always the right time to do what's right. Another quote from Reverend Dr. Martin Luther King, "It is the fierce urgency of now." And I think we have expressed very eloquently in a lot of different ways that right now is an urgent time for us to take action on this. But it's in you, and I appreciate that you're furthering your education and furthering your advocacy in this space.
Great way to frame the whole picture here. I remember that many of the participants of this discussion were suddenly shut down around that time, and in 2017. Adele, did you want to bring up your last point there before we close?
Yeah, I hate to steal Natasha's thunder though, but that was so great. The idea was co-benefits. So the idea is that you want to be very clear about what the hazards are that you want to be focusing on, because they're going to be different. But the good news is that many of the interventions, whether you're in the built environment like I am, or you're more in the policy realm, or you're more in clinical realm like Gredia, many of those interventions are going to be similar. So you can think about tailoring what you're doing so that it can benefit both, in my case, heat, drought, and flooding, and yet still be targeted in what you're doing. So that is a really good thing. So it's not like you're going to have to end up with 100 different interventions. You might find a few key interventions that have a whole lot of benefits for lots of different aspects of climate change, as well as social justice and other issues.
Great. Well, thanks so much. Colleen, did you want to have a word at the end here?
I just wanted to say the bottom line takeaway from this webinar: we have demonstrated that climate change impacts virtually every aspect of physical, mental, social, and environmental health. And the people who are most vulnerable to the health impacts of climate change are the most vulnerable to virtually every aspect of society, economically, physically. And so those are the primary factors we need to keep in mind when we plan for our emergency shelters, for our and for any aspect of climate change response.
Well, thanks, everybody. We have been recording this, and we will put that together with some of the resources from chat and if we could, if I could ask our speakers, if you haven't already, if you could send your slides if you care to, I will put them, probably post them as PDF for everybody. So thanks, everybody. We look forward to our next gathering.
Yes, thank you, Steve, for serving as coordinator.
Thanks, everybody. Bye.
Thank you to our speakers.
Thank you.
Yes.
Bye.
Such helpful, informative,
Wonderful.
great.
Thank
Wonderful
you.
Thanks.
job.